right, good evening, everybody. Welcome to tonight's webinar. Again, my name is Kelly, and I'm a 9-year breast cancer patient and 3-year metastatic breast cancer patient. Tonight's webinar is brought to you by Brightbod, the fine folks at Brightbod. Once again, I'm not a doctor, so please do not construe my advice as medical advice, just based on my own personal experience and research as I've undergone the throes of a cancer patient. For folks not watching live, you can still interact with us by going on to brightbod.com and record yourself asking a question. You're able to get out there, record yourself asking the question, we can get out and respond in the same way. So do go out there and help us out that way. I'll be talking for about 20 minutes. I'll be muting your guys' microphone. And after that, we'll be answering questions with you guys. Again, it's my favorite part. Really love to listen to you guys are listening and paying attention. So thank you for that. All right, let's go ahead and get started. Okay, so, excuse me. Tonight's topic is selecting the best oncologist for your needs. Among the best and most critical conversations and decisions you're going to be making as a cancer patient or potential cancer patient is choosing an oncologist. And choosing the right oncologist can literally mean, in some cases, life or death, based on making the right or wrong decision. So this is really a critical decision in that space. So most cancers are actually not diagnosed by an oncologist. Most cancers are diagnosed by a family doctor or a radiologist based on symptoms or tumors that are felt, lumps that are felt, or being symptomatic. So usually you're going to be working with your family doctor to make recommendations, as you start this cancer journey. So the first question that I would always ask the family doctor is, hey, if this was you and you were dealing with the cancer situation yourself or a family member, what would you do? Which doctor would you see? Which institution would you attend? The candor that you're going to get from them is really going to be important because they know doctors, they know oncologists, and they know quality care. So we definitely want to make sure that we ask that question if something like that happens to you, so you can get really great advice and make sure that you're starting on the right foot. In some cases, you're not living in a location where there's a lot of really great cancer hospitals. Maybe you just haven't even thought about it. You haven't dealt with cancer in the past. So the first question I would always ask is, hey doc, who would you pick if this was your loved one or you going through this situation? And as you're being diagnosed with cancer or potentially cancer, it's a very dark, deep hole that you could go into, and there's a lot of stress that's involved here. So you make sure that you're writing stuff down and taking a member of a family or a friend with you, so you can make sure that you're retaining this information, because a lot of people get anxiety that makes them forget exactly what's going on. So do write those things down. In many areas of the country, there are now popping up centers of excellence with cancer care. I can't think of many areas of the country where there aren't, within about 3 to 5 hour radius, really great hospitals that are providing quality cancer care. So get out there, use the internet, Google a little bit, and figure out what the closest one is to you, because more than likely there will be. Another great option to use with social media is reaching out to your friends and family and say, listen, who out there has had experience with a local cancer center of excellence? What are your experiences with this doctor, that doctor? What are your recommendations? And this is really turning out to be a fantastic way to gut check and level set with a lot of doctors and get a good indication about what you should be expecting when you go into there to visit with them. I personally have recommended a lot of doctors on social media, and also provided some feedback on social media that says this doctor might not be the best choice for you based on what I experienced. There's a number of other doctor rating sites, and then ratemydoc.com. In an age where you can go out and say whatever you want online, you can get a whole lot of feedback that may or may not be your own experience when you go visit with this doctor, but you can certainly get a good consensus when you're out there researching a doctor that you're considering, or a research institution that you're considering as well. In this case, what is the most convenient might not be what is best for you. there may be a local oncologist who is 10 minutes away, where a center of excellence may be 3 hours away. Do consider getting a second opinion at the center of excellence. I have dealt with many situations where local oncologists don't always have the most up-to-date research, in some cases not the most up-to-date facilities or treatment options as a large cancer center of excellence might. So just because it's close doesn't mean it's the best option for you. So do obviously consider looking at multiple locations, even if it will be a little bit more inconvenient for you to get there. All right, so you know you have cancer, and you're trying to make the decision about the best center of excellence and where you should be going to. There are a number of ways that you can tell that a center has been reviewed by a number of impartial areas and nonprofits even that will tell you this is the best opportunity or maybe not the best opportunity for you. The first thing to look at is the hospital or clinic accredited by the Joint Commission? The Joint Commission is a nonprofit that reviews hospitals on an annual basis and determines if they're clean, safe, and if the treatment is effective out of these locations. So it's a non-biased, impartial entity that that can certainly give you a good indication that you're going down the right path if you're working on selecting a particular clinic. Another thing to consider is this a comprehensive cancer care clinic? Does it offer all the services that I need as a cancer patient? And that's going to include things like pathology reports, the tumor board. The tumor board is a group of people that are experts in pathology, oncology, research oncology, that kind of stuff that can really make the best decision for your care based on consensus. So you don't just have one person that is making the decisions for your care. You have a whole group of experts who really understand what's going on and can make good recommendations. So a tumor board is really critical in a lot of places that you're going to be considering. Another key considerations for a cancer hospital is, does it have a social worker on staff? You know, people that can help work through some of the financial challenges and even some of the emotional challenges that come with being a cancer patient. Pathology is really important as well. Labs, diagnostics, and imaging are really critical factors. Otherwise, you're going to be going between your clinic and a hospital that actually has those devices and areas. So you want to find a location that has the whole package when it comes to cancer care, including facilities for radiation, facilities for chemotherapy, immunotherapy, and in some cases even research institutes that are co-located with the hospital as well. Something else you're going to want to consider is the hospital approved as a National Cancer Institute Cancer Center? And that's a mouthful, but this is really important for cutting edge research. There's about 15 different institutes that are located across the US that are NCI certified. And these are going to have the best clinical trials, the best research, and the best opportunity for you to get cutting edge treatment that may be on the forefront of technology right now. So I was talking to a patient earlier today, and she was saying in the past 3 years, metastatic melanoma has had many developments in how we treat it. For example, a drug called Keytruda, which Jimmy Carter is on, and it has totally eliminated his brain metastasis from metastatic melanoma. So now really is the time, if you have to have cancer, now's the time to have it, because things are really starting to move, and research is starting to come out that could help us live longer, and to make sure that you're getting that great care and the most cutting edge science. You do want to try to go to a National Cancer Institute certified location. And the last thing is, are you seeing an oncologist who specializes in your cancer type? There's a number of rare cancer types that not many oncologists in the world know about. Some neuroendocrine cancers and some sarcomas are so rare that they only present in a couple hundred people a year. So you're not going to go to an oncologist who doesn't understand that kind of cancer, or just may pull something out of his hat when it comes to treating it. You want to go to a doctor who really understands your cancer type, and there may actually be a doctor who specializes in that cancer type. So that may involve traveling a lot farther than what you were anticipating, but it really is the best decision for your care. If you want to get the most specialized personal medicine and personal attention, you're going to want to go to some place like that. Locally, there is a clinic that specializes in metastatic breast cancer. And although I don't go there because I really have vetted my current oncologist in the greatest of ways, it's certainly someplace I would consider getting a second opinion, because not many clinics in the country, actually this is the only clinic that specializes in metastatic breast cancer. They really are moving the needle when it comes to how we care for metastatic breast cancer patients. All right, so you've decided on an oncologist. Now what do? You meet with them. There's a number of things that you can do and that that you will experience that will tell you I have the right oncologist or I'm not with the best guy for my particular situation. That really starts with the treatment plan. So what are they recommending that you undergo? Is it something a lot more aggressive than what you were expecting? Is it not nearly as aggressive as what you were expecting? And really, you want to walk into this situation where you've done some research, you've done your homework. Don't go research all the statistics and all the survival data. It's really dated, because if you think about it, the 5-year survival data is based on treatments that were at minimum 5 years ago. So as things are developing and drugs are being brought to market and being fast-tracked nowadays, those survival statistics are now very invalid. So to give you an example, metastatic breast cancer used to have a median survival of 30 months. And with recent developments, it has now just been announced, median survival has jumped by 10 months. So half of the cancer patients that are metastatic, live for 40 months instead of 30 months. So it doesn't seem like a long time when you're talking about, 10 months isn't a long amount of time, but when you're facing death, it's a great amount of time. So definitely do your homework when you walk into that conversation with your oncologist. So you're going to get a pretty good gut feel if this is the right recommendation that they're making. Ask them about the treatment goals. What do you plan to accomplish with this treatment? Is it being treated curatively? Do we expect that we're going to get rid of every cancer cell? Is this going to be treated palliatively? Do we have an advanced cancer that can't be cured but can be managed over the long haul? Or do we have something that we're talking about end-of-life care where we want to just manage the side effects or address pain as you approach the end-of-life situation? Hopefully most of you are going to be in the earlier stages where the treatment is going to be to cure, but not always is the case, as is with my case. What are you going to expect from a side effect perspective? If they tell you you're not going to experience anything, but we know that's obviously untrue because there's really nothing that doesn't come with any side effects. So expect candor and request candor when you're explaining the side effects that you can expect with treatment. What is their bedside manner? Do they make you feel comfortable? Do they make you feel like you're just another number? Get out of here. I have to go on to the next person. This is not important to me. Or do they take the time to answer your questions, sit down with you and really make you feel comfortable and like you're a partner in this treatment plan? Because that's exactly what a good oncologist should do. Another thing a good oncologist should do is recommend you get a second opinion. It doesn't take away from their expertise at all. If anything, a second opinion from a good clinic will actually allow you to feel good that, hey, they made the same decision, they're recommending the same treatment protocol, I'm on the right track, and I'm with the right oncologist. So second opinion is something I recommend thoroughly, and it's something that everybody should do to make sure that they're getting the best care for their particular situation. All right. So what are some additional considerations in choosing an oncologist? We mentioned this earlier, but the availability of clinical trials is huge. This is really your opportunity to get the best care right now that hasn't even been approved by the FDA. This is stuff that may take another 10 years to get approved by the FDA. So when you have the opportunity to take part in a clinical trial, a number of benefits. The benefits include that most of the treatment's free. Because it is experimental treatment that is not on the market yet, so the drug companies provide it to the patient with no cost. So I'm a huge advocate for clinical trials. I know so many people that are alive because of clinical trials. In fact, my best friend was recently put on a clinical trial. So it's something I advocate for completely. And again, those NCI hospitals are going to be really involved in the clinical trial world. Genomic testing. This is critical from a precision medicine perspective. So people say cure cancer. That will never happen. cancer is not one disease. Breast cancer is not one disease. There's at least 16 different types of breast cancer, and then within those breast cancers is every person has a specific genetic mutation that makes their cancer occur. So basically, cancer comes from your own cells. It is not going to be responding to the same way that somebody else's cancer was, even if it's the identical pathology. So genomic testing are things like the FoundationOne test and KRAS testing. Another test called the Guardant test is looking for, it's a liquid biopsy looking at blood and free genetic material in the blood. These mutations can actually say, hey, there's 20 different clinical trials that you qualify for that may actually be the Achilles heel to your cancer. So there's standard therapy that may work well with precision medicine, but in many cases, there's about 40% of breast cancer patients, for example, that have actionable mutations, that will actually, there's medicines available to treat them. So it is imperative to get that testing right away to make sure that you're on the right path and not just getting what everybody else gets, because this can really mean the likelihood that your cancer can go into remission or that you can experience a lot of progression early on. So important. Malleable bioethics. This sounds a little bit shady, I realize, but there's a lot of situations where your doctor can kind of bend the rules a little bit and get you the best care, even if it isn't approved by the FDA yet. For example, my oncologist got back from the San Antonio Breast Cancer Symposium in San Antonio, obviously, and found out that Faslodex and Ibrance, which had not been approved by the FDA, had a better efficacy rate than the other alternative, which was letrozole and Ibrance. Well, it wasn't yet approved, so instead of making me wait until it was approved, he said, I'm going to go ahead and prescribe you letrozole, and then we're just going to put it under the table, basically. We're not going to take the letrozole. We're going to be taking the Faslodex and the Ibrance. So I was getting the best care available right then and there without having to wait until it got through the FDA, which was not until about a year later. I experienced a complete response to therapy, and I have continued that response for 32 months. And it is, I believe, because my oncologist was willing to bend the rules a little bit so I could get the best care without having to wait for the FDA, that they can really drag their feet for a long time, which you guys probably know. The last thing is hopeful realism. You don't want to walk into an oncologist office who's going to tell you, yeah, you can cure stage 4 cancer, we're going to get you cancer free. That's absurd. You also don't want to walk into an oncologist who's going to say, you got 6 months to live, you better get your affairs in order. And I've seen both ends of the spectrum. So we want to hear things like, even if it is an advanced cancer, we can manage this. There's lots of new drugs coming out. I want to hear about the reasons that I have to be hopeful. And there are a lot of oncologists out there who have those reasons and have the science and the experience behind it to really make you comfortable in your situation. So we don't want a doom and gloom kind of response. We don't want sunshine up our butts either, but you want somebody that's kind of in the middle who is willing to work for you and advocate for you in that space. So what should I expect as my relationship evolves with my oncologist? This is after you made your decision and you're under treatment or you're post-treatment. You should expect face time. You should expect that, even if they gave you a lot of time to begin with, now they're going to rush you out of the office every time you go back and see them. You deserve to spend as much time as you want with your oncologist, and they should schedule accordingly. So if you are not being taken seriously, after your cancer experience or during, you're not getting the face time that you want, it may be time to get a new oncologist. There's nothing wrong with getting a new oncologist even after you're done with treatment. So do keep that in mind. You want a doctor that's going to continue to explain to you as you progress through this cancer journey, the scans, the diagnostic test, and the lab reports. So somebody who's going to say, this tumor marker test indicates that you are, still within the appropriate range, or your white blood cells are out of range now, and here's what we want to do about it. You shouldn't have to ask those questions. They should be the ones that are bringing those things to your attention. As a cancer patient, you will at some point probably get scans for a long time, if not for life. So you should expect to get monitored for a while until you have a decent period where you've had no active disease, or in my case, I'm monitored for life. But for early stage patients, for about 5 years, I'm monitored about every 6 months. I'm getting a scan to make sure that there's nothing coming back. So if they say, you're done with treatment and you don't have to ever get a scan again, I'd be really skeptical of that. A good oncologist, again, considers treatment advances. You know, they're not going to rest on their laurels and say, okay, well, the standard protocol is chemotherapy plus this and this. There's a lot of new immunotherapies that are being developed nowadays that are less toxic, and really have a better efficacy rate than a lot of the cytotoxic chemotherapies that we have experienced in the past. So quality of life is a lot better as long as your oncologist is keeping up with those discoveries that are being made. You want an oncologist who's going to be honest about your recurrence risk. You know, there, in almost every single cancer out there, even early stage, there is a risk of recurrence. Most doctors don't talk about it, believe it or not. In fact, part of my advocacy is reaching out to people and saying, there's a 30% recurrence rate for early stage breast cancer. And in other cancers, it's a lot higher. For example, lung cancer has a 90% recurrence rate. Yet you have doctors who are removing lungs or part of lungs and stuff like that, when it's more than likely going to come back later. So you don't want a doctor who's going to say, okay, you're cancer-free, go live your life. No such thing as cancer-free. There's no test that is sensitive enough to determine that. Nor should an oncologist use the word cure. That's a very controversial term in the cancer world as well. So be mindful of those things. And if you follow these tips, it'll really help you make sure that you're making the right decision for your cancer care, or the cancer care of your loved ones. All right. That's all I got. Ready for your guys' questions.
Kelly, I have a question.
Mm-hmm.
What do you do if you're...
Sorry about that.
If your second opinion oncologist, his treatment differs from the first one, what do you do in that case?
That's a great question. So I would go on to get a third opinion. I know people that have gotten 5th and 6th and 7th opinions because there wasn't a whole lot of consistency in the recommendations that were made. At the end of the day, there may actually be 2 different treatment options for you, and that's okay. So after you get a third opinion, let's say you know that they matched with one of the individuals that you had met with before. Chances are they will. But if you get a third opinion and the third opinion is completely different as well, I would keep going until you get at least one doctor who agrees with another doctor, and that gives you something to start on. I would be surprised if you go to more than 3 or 4 doctors and don't get somebody that agrees with what the standard of care should be for your cancer type.
Okay, thank you.
Great question.
What does someone with cancer do when they go to their oncologist and he or she says to them, we have done all we could and there's nothing else for us to do?
That's another fantastic opportunity for a second opinion, and something that I find myself advising a lot of my friends who are also metastatic and are told that by their doctors. If you're not already going to a center of excellence that really focuses on the research opportunities, then I would certainly look at a second opinion. There is always reason to hope. Up until the point where you're on hospice, and even if in some people that are actively in hospice, I know people that have flunked out of hospice because they got the right opinion from the right doctor who said there still may be tools left in the toolkit for you. So just because somebody says this is all that we have for you, I would that may be at the end of your treatment regimen, obviously, but I would definitely say, you know what, I'm going to find out what somebody else thinks, and a lot of the boards that we use, the Facebook boards and support groups, have a lot of feedback that speaks to this. So I would certainly ask what they thought about it, and if they're in a similar situation, that can provide some some guidance and some reassurance and some hope, because there's a lot of people out there that have done just that and are still alive today because they didn't just accept what one doctor said.
Okay, thank you.
Thank you.
Kelly.
Yes.
Usually when you go to see, like I said, an oncologist, you normally get referred by your primary care physician or something like that. Now, is it customary like, could you ask him for like several different referrals to different people so you can get different opinions? Is that customarily done, or?
It is. So I should have mentioned this earlier, but a lot of times, people ask doctors, if you had three choices to make, who would you go to get your care with? And another good reason is because you might not just have one oncologist. A number of people end up with as many as 3 or 4 oncologists, and not because they picked one over the other, because certain oncologists specialize in different kinds of care. For example, there's oncologists that specialize in radiation oncologists. You may also have a medical oncologist, a palliative oncologist, a surgical oncologist. So that's just part of the normal conversation with that primary care doctor. Say, okay, if you had 3 choices or 4 choices to make, who would they be? And that may turn into 12 choices based on, if I had to pick my team, this is what I would expect. There's that protocol certainly exists today when these doctors are diagnosing cancer and making those referrals.
Okay. Another question. I live in Tampa, Florida, and Moffitt Cancer Center is, 20 minutes away from me, and they're ranked pretty high nationally. And I just assumed that if I ever got cancer, that's where I'd go. Is that not the correct mindset? Should I be looking around some more, or do you think that's a good place to start?
I think it's a great place to start. You're one of those lucky individuals who lives close to a fantastic cancer care center. My advice earlier about, what's closest isn't always what's best, really pertains to people that live in rural areas, who have a local oncologist who sees, a couple thousand patients a year. And then seeing somebody much further away, like Moffitt, would be a lot more inconvenient for them. But you certainly would not need to look far unless you didn't get the kind of responses that you were looking for from the Moffitt Cancer Center. But that's a fantastic hospital.
Great. Thank you.
Mm-hmm. Thank you.
I have a question. What do you mean by genomic testing? What is it, and what are some examples of places that provide that service?
So genomic testing is actually looking at the tumor and determining its DNA. So a tumor has its own DNA. It's DNA that is fraught with mutations because cancer doesn't exist without mutations. Genomic testing identifies what particular mutations this person carries, and in that case, are there any medicines out there that can combat this cancer based on mutations that either it is acquired or something that you've inherited from a parent. There's not any institutions that do genomic testing, but there's a number of different companies that do. And nearly every good oncologist can send your tumor sample away or blood sample to get that testing done. It could be very expensive, but it is absolutely worth every single penny. In some cases, around $5,000, $6,000 to get it done. Those tests include FoundationOne, which is the standard of excellence, Caris testing, that's Caris with a C, and the Guardant test, which is the blood test. So it's something that you should absolutely do if you get diagnosed with cancer. In my case, it actually wasn't very helpful. It didn't reveal any mutations that were actionable. I have a couple that was called unequivocal, which means that maybe and maybe not. But it was really very telling in that the testing said no mutations. I'm responding 100% to standard therapy. That's not by coincidence. That's because I don't have any mutations that are causing my cancer to be tricky. It doesn't evade standard treatment or become resistant to hormone therapy, for example. Unlike my best friend Lisa, who has a lot of mutations, PIK3CA, mTOR mutations, BRCA2, those mutations have allowed her cancer to outsmart treatment. So this told our oncologist from the get-go that she needs to be on a special treatment. That's exactly what she's on right now.
Is there any danger that if a patient goes to a clinic that they're going to try to change her treatment goals, her treatment goals that she set for herself? Does she or she have to worry about being pressured into thinking in one way or another?
I've seen that happen. I have. I'm thinking about a situation where a friend of mine who is metastatic has a single metastatic lesion, and is HER2 positive. So HER2 is a specific type of protein that some breast cancers overexpress, about 20%. Her current oncologist was retiring, and the new oncologist said, "Oh, we're going to treat you for cure. You have, one lesion. We're going to stop Herceptin, which is the gold standard for HER2 breast cancer treatment in the metastatic setting." And they said, well, "We're going to stop treatment. You don't need it anymore. You're fine. You're cancer free." She was really torn about this. I mean, I think on one hand, the hopeful person in her was like, well, maybe I really can't be cured. Maybe I don't need to be on this, on this ugly treatment for life. Thank goodness she reached out to her Facebook community, and we vehemently said, no, that was absolutely the wrong decision. You need to be on Herceptin for life. And the only reason you stop Herceptin is if you have heart troubles, which it does cause, and you're faced with your heart stopping or cancer coming back. So I think that people do encounter pressure from, either you're not doing the most aggressive, or, hey, we can cure you, whereas the other guy couldn't. Really trust your gut when it comes to those things, and do your homework. If you've been told by everybody else that that's HER2 positive has been on Herceptin for life, don't let the shiny object syndrome make you feel like, well, maybe I can be cured because this rogue doctor thinks that can happen. So I recommend always taking somebody with you, in some cases somebody who's very forceful in those conversations, and to really do your homework on your own cancer type. If you know that stage 4 breast cancer is not curable, then you will be able to stand firm in that resolve and say, we're not going to stop treatment. This is the wrong decision for me.
I have another question. It's in line with what you were just describing. Let's say I have a doctor who has a very nice bedside manner, but I have no idea whether or not my doctor is keeping up with the latest advances. I don't know really, so I would prefer to have somebody who's more knowledgeable with respect to the most, advanced treatments and technologies than to have somebody who has a good bedside manner. So how do I figure out whether or not I'm just being lulled by comfort? How do I know whether or not my doctor is really the right doctor?
There is no quick and easy way to do that. In order to figure that out, you have to actually educate yourself completely about your disease. You have to go out and read, the latest and greatest abstracts about, what the NCI is doing, what the latest copper depletion therapy looks like, and the collagen therapies, and the nanoparticles that are laser activated. You have to know those things to walk in there and be able to know if you're being bullshit. And that's hard for some patients because they don't really want to spend the time, or they just don't have the attention span, or maybe they just don't want to learn about their disease. If you don't know what the best options are for you, what the latest and greatest are, you won't be able to ask your oncologist and know if they're trying to pull the wool over your eyes. I have walked into an oncologist office and I have taught my oncologist things, my past oncologist, and I have walked into oncologists and I had really fantastic conversations with my current oncologist about what the latest and greatest is. Now, you don't have to be as well versed as a medical oncologist on it, but you do need to know what's coming on the pipeline for your type of cancer, so you can know if this guy knows what he's talking about. If you ask questions about, is this available? What do you think about this? It would be a good treatment option for me? And they just kind of look at you, like a deer in the headlights. Even if they've got a great personality and they're making you feel great, they might not be the best oncologist for you. I'd rather have a jerk that knows what he's talking about than a really, really nice person that doesn't.
Thank you.
Thank you.
Kelly, I have another question.
Sure.
Who are the individuals that are typically on the tumor board?
So the tumor board is going to consist of a number of different individuals. You're going to have the medical oncologist that is primarily focused on drugs to treat cancer. You're going to have a radiation oncologist who is focused on radiation therapy as a way to treat cancer. You're going to have a surgical oncologist who is focused on removing cancerous tumors to achieve clear margins in the body, or is it even possible to remove cancerous lesion? You may have internists as well who specialize on the internal structure of the body. pathologists who can understand the nature of the disease and the disease course. That's pretty much the typical structure of a tumor board. You may also have a non-oncology surgeons, just surgeons that are pretty structured in whatever area they're going to be operating on. But those are the main players in the tumor board, and really a key group, a key committee for making decisions about your cancer care. So it's kind of like you get an oncologist and you get 6 for the price of 1, because you're getting a really great collaboration with those individuals. Not every cancer center has them. It really is an important thing for the patient to get the right care.
So the board, would they be the one that decide your course of treatment or suggest your course of treatment?
In many cases, they will be. So the board will meet on every new case of cancer. They will look at the pathology report and they will say, okay, well, I believe that since it's spread to 6 different lymph nodes, that we need to be more aggressive with our treatment options. The board will also often meet when people have progression. So, in the metastatic setting, we're dealing with the chronic type of cancer. So if there's progression to liver, lung, whatever the case may be, they may meet and try to determine why is this cancer now behaving differently, and how can we make the recommendations for the patient. The face of your treatment will still be your oncologist that you have that personal relationship with, but they have the backing and the feedback from that entire board that can really make sure that we're going down the right path.
Okay, thank you.
Thank you.
Kelly, to follow up on that real quick though, I have somebody, a close family member, who had cancer and went to the board, and they were sitting there, and apparently everybody had their own opinion on what the treatment was going to be like. What the surgeon guy says, yeah, we got to take it out. The radiation guy says, no, let's treat it with this. And it eventually they left it up to my family member to, he decided what he wanted, How does that work?
That is a really unfortunate situation. I know a number of people who have been given options. Here's what you can pick from a treatment perspective. That is absurd. We should not be making decisions as patients on our own treatment. We should be given direction, and based on our comfort level with the oncologist and the team, we can certainly choose to go with or not go with that. But when you have a tumor board that can't even make a decision on what the right approach is, you have a whole bunch of egos, which is what it sounds like to me. We're at the wrong hospital. So I would really encourage them to go to a different clinic and find a group that can get over their own egos and really do the right thing for the patient. I have personally encountered that with a surgical oncologist who wanted to resect my bone metastases. Resect as in remove them. Well, it would do no good to remove bone metastases. I still have systemic cancer. It's not going to go anywhere. And you really can't remove bone. I mean, it's not like a liver tumor that would come out. You have surgeons that are cutters, and some of them just are so focused on what can I remove, what can I take out. That was not, at the least, the best advice for me. In fact, it was a little insulting. So I switched surgeons as well, because he was supposed to take out my ovaries. That did not happen. Not saying that there may be some hospitals that have really great tumor boards. There may be some that just don't. And if they're giving your relative options, he or she needs to go find a new clinic. That is absolutely out of the question.
Well, luckily for them, they actually made a decision. It's been a couple of years now, and they're progressing, well, and they're cancer free. So yeah.
That's wonderful. The thing that scares me is when patients make their own decisions and then they have progression or they eventually die. There's that guilt factor that gets levied upon them, and they're like, well, what if I would have picked this or that? Would things have been different? You are not the oncologist. You are expected to educate yourself and advocate for yourself, but you don't get to make those decisions. That is absolutely ridiculous to me. I'm glad they're doing well, though.
Thank you.
Kelly,
Yes.
does the patient always have to have a cancer board?
No. There are a number of clinics that are still high quality clinics that don't have a cancer board. In many cases, there's a little informal board that's happening anyway. There's a boys club or a girls club of oncologists, and they may have a good friend who's a medical oncologist and a buddy who's a radiation oncologist. So even if you don't have a formal board in the formal sense, you may still be getting the benefit of those collaborations behind the scenes. So it's not essential in your care, but certainly not a bad thing to have either.
Okay.
Great question.
I have another question. With all of these first opinions and second opinions and third opinions, and there's also a whole healthcare team behind any patient. Do you have any suggestions or tips on how to get the doctors to communicate with each other, as opposed to just presenting them with a file and asking them to opine on it?
Yes. So there's really cool technology that's coming out of late, and something that I've recently even gotten to see working. They're starting to share information in a cloud setting. So we're talking about scans being shared in the cloud, pathology reports being shared in the cloud. And this really makes it a lot easier for medical information to be shared, cross-functionally, so we can make sure that we're getting the best care. I would, again, do my homework. And, if you have an oncologist here that's local that you feel good about, but you found a cancer specialist in Oregon who specializes in neuroendocrine breast cancer, it is absolutely allowable and encouraged to reach out and say, hey, I found Dr. Cross who is in Oregon. I'd love for you to confer with him on this. And a good oncologist will say absolutely. There are a number of people that are here treated locally in Bentonville, Arkansas, where I live, who their oncologist is actually in Mayo or Baylor. There's Walmart's home office is here, so there's a lot of wealthy executives that work at Walmart home office. So they go to the Center of Excellence to get their oncology visits, but their orders are being carried out here by local oncologists. So that collaboration is absolutely there, and it is encouraged to continue in that space. So a good oncologist will say absolutely, and the best thing that could happen is say, hey, we're doing the right thing, we're making the right decisions here. All right, that's all the time we have for today, guys. Thank you again so much for your time. Have a great evening, and we'll see you next Thursday.
Thank you.
Good night. Bye.
Bye.